How we doing? We okay? It's a lot of data. I mean, a lot of data. Data makes people want to go to sleep. So I'll do my best to keep you awake for my 10 minutes of this and try to share a little bit. I want you to think 10,000 feet up. Some of the spatial views will be a little further than that. Try to understand. I want you to see the forest. We might get to a tree, maybe not. But just think about it big picture, because I think that's really what we're dealing with. This isn't about a solution. It's one piece of this much larger puzzle that I mentioned earlier. So cardiovascular disease, something I do know something about. 610,000 people die every year in this country, about 1 in every 4 deaths, leading cause for both men and women. And the risk factors you see there, blood pressure, cholesterol, diabetes, smoking, it's stuff that we've known for a long time. And about half of all Americans have at least 1 in 3 of these. Unfortunately, our cardiovascular disease profile isn't equally distributed across our country. Red means hotter, hotter means disease, and as you can see on this map, if you take nothing else from this picture, you know, if you live up in the Northwest, we've used that before, the Southeast is cardiovascular central, whether it be for stroke, ischemic heart disease, pick one, all right? So when you look at that, it should make you pause. Even if we're not talking about air pollution, it should make you pause. But then go to this. This is the part that's interesting. So I was at the Framingham Heart Study before I came here. When we think about cardiovascular risk in the clinic and you see your doctor's going to say, how old are you, man, you woman? What's your cholesterol? What's your smoking? Are you diabetic? What's your blood pressure? And more recently, you've probably seen in the news, we might even add race into this now with the new predictive models. But what you're noticing is there's not a whole lot of environmental anything in there, right? Nothing, zero. So you might say to yourself, well, why might air pollution be important? So in epidemiology, everything is about exposure, and usually with exposures, it's the duration of the exposure. So people on average get blood pressure about the 4th decade of life. For diabetes, it's changing because of the obesity epidemic. Even if you think smoking, my wife's a smoking expert, she'll tell you that even teens would be the earliest. But air, you start at day 1. And you can't get away with it. We're all obligate air breathers, fortunately. So you know, given that, you'd think that we would, you know, this would be something we would ponder a little bit, because you have to. You can't escape it. So I won't go into what is air pollution. You already heard that. Particulate matter is something that people have studied, so we're going to go with that. And what is that? So it's these things that are in the air that we breathe in. Diesel soot would be one. But here's the part that's really fascinating. It's this particle size, and why should we care? So these particles now, the smaller they get, they're even getting into the 1 micron area where it goes right through your lungs and into the bloodstream. There's not even a barrier, right? And there are other models for this. So one of the things I'm very interested in is HIV. Why? Because HIV, we think, is this model for accelerated aging because it's this chronic inflammatory disease. It does very unique things. We see people with HIV getting cancer, heart disease, way younger than we expected. In fact, in my area, we started looking at heart disease because we had men in San Francisco with no cardiovascular risk profile having heart attacks in their 30s. With the models I just showed you, they had no business having a heart attack. They weren't diabetic, they weren't smoking, they weren't older, and their cholesterols weren't bad. So that virus does things similar to this. It goes through, when it wipes out your CD4 cells in your gut, it lets all that stuff in your gut leak right across your gut membrane and go right into your circulatory system. All those bacteria you don't want there are ending up there. And we're seeing this chronic inflammatory state that now we're seeing, gee, they're getting lymphoma earlier, and cardiovascular disease, and they're getting stroke, and they're getting liver disease, and they're getting kidney disease. Why? Because every organ has a blood supply, right? Every single one. So if you've got these particulate matters now that are going right through your lungs, down to your terminal VLI, through the barrier, do not pass go, do not collect $200, and right into your circulatory system, that is perpetual, chronic, inflammatory exposure that will never, ever stop unless you become a non-obligate air breather. And so that should make people pause. Now, there are a lot of reasons people get this, and you'll see up there, you know, motor vehicles, emissions, but combustion, and I'll put it in quotes, is this thing that seems to be one of the driving forces. Big coal-fired power plants, or it be cars, or burning your wood stove. Now, this is a global distribution. Take a look at China, way over there. Really, really red, okay? Now, if you look at this map all by itself, you think, well, gosh, the United States doesn't look so bad. I mean, relative to everything that's happening in North Africa, the Indian subcontinent, and going over there. But you would be mistaken. It's just an issue of axis. There is no safe amount of particulate matter. If you go back, see if I can make it. Am I talented enough? Good. This goes to 80. Kind of like if you ever watched the movie Spinal Tap, probably predates people. You know the amplifier goes to 11. But this goes to 80, where this only goes to 20. But the point being, there isn't this safe amount, and we're definitely in a space that doesn't make sense. Now remember this picture. Look at that picture. Picture. You know, it should make you pause that in the same place that you've got the highest distribution, you're seeing the same distribution of heart disease. Am I saying that air pollution is causing all heart disease? No. What I'm saying is that it's an interesting overlap. And in fact, an environmental person did in 2009 where he linked them and said, what happens with the distribution between air pollutants and cardiovascular risk, and do they overlap? And of course, they do. So this slide's to kind of make you go a little numb, but the real point of this slide is that as an epidemiologist, when we see one association in one study, we think that's really interesting, do we believe it? And then everyone starts picking it apart because if it's a new paradigm, it must be wrong because we should know what we already know. But the point of this is you've got like 30, 40 slides and they're all showing similar things. This is the forest view, not the tree view. If it were random, you'd expect above the line, below the line, we're seeing an association, not seeing an association. Everyone's seeing an association. And we're all arguing about what the effect is. Right? When you get to that point, that's where people should start saying, Because if you want to argue about, is it 10%, is it 20%, you're missing the point. All right? And people like to get down in the weeds. They love it. It gives them identity or something to fight about. I don't know. But, you know, we don't want to be in the weeds. At least not yet. And this slide is particularly important because when you think about epidemiology and cardiovascular disease is a chronic disease. So interestingly enough, you know, when we discovered that, when we looked at autopsies of children who were in trauma and died, and they'd have no business having profound atherosclerotic plaques, when we autopsied, we saw in their femoral arteries, their carotid arteries, even their aorta, we saw plaques with kids that shouldn't have it. What's that mean? Atherosclerosis starts at day 1. And it goes up or down depending on our exposures and risk. If you look at this slide, what's interesting is that even in a given day, you can increase your cardiovascular risk or actually have an event with particulate matter. Which suggests to us that it's not necessarily just a potential amplifier, but it can actually be a nidus or a trigger on top of the normal atherosclerotic process. That's kind of important. For a couple of reasons. The biggest one is, you know, how do you prevent that on any given day if you're a doc, right? Do you tell your patients to stay inside on bad air days? What do I do with my 65-year-old who's got hypertension, diabetes, obesity? She stopped smoking, thank God, and she says, I have to go to some event today, and the particulate matter is extraordinarily high between the pollen and whatever may be happening because you're in a valley. I grew up in Oregon, where it's valley, and when you're in a valley and you don't have wind, everything stays there until you get some. So what do you tell these people? Can't go out? Stay inside? What if you're in a high-risk place? How many days do you ask somebody to stay inside? I mean, it's not practical. And they don't listen to you. They're like, nope, I've got to do what I've got to do. So translating all this data, let's make it really simple. Some people would say that if you increase 10 micrograms per meter cubed to this PM25, basically one person dies for every 5 million people. Now, why is dying not the right outcome, in my opinion? Well, I mean, there's a lot of reasons for that, but we like death because it's easy to study, right? You either did or you didn't. It's a really nice dichotomous split. It's really nice to study, but it's not really the right measure. And why do I say that? So if you look at cardiovascular disease for me, you know, in the last 50 years, we've gotten really clever with it. I kind of joked before that, you know, people aren't dying of it anymore, which is good, but the point is, you know, if you start having chest pain, you get to the hospital, we may prevent you from having the heart attack, right? You don't meet criteria. Your enzymes aren't up, and you don't have these EKG changes. We get you in, we put the angiogram in, we give you a stent, and voila, you live, all right? But you still came to the hospital, you still have coronary heart disease, you're still going to have a bill, you're still going to go on medications for the rest of your life. You get the point? That's not in that statistic. That's not there. What happens if you come in with stroke symptoms and we do the right thing and we get all those drugs in you and you don't have the permanent, my left arm doesn't work? You're still part of the system, okay? So while it's nice to study death because it's easy, it's really just this small fraction of the outcome we should be caring about. And if you don't do that, you're missing what I got to earlier, which is the cost, right? It's the cost, stupid. And it's true because it's hard to capture that cost. You know, if you look at MI rates and death since like 1950, it's gone down like this. And if you look at heart failure incidence, it's gone up like this. It's the price of success. You don't die of your heart attack, you just live with a damaged heart for 30 years. What they haven't given you is the corresponding graph that says, here's how much money we're going to spend keeping all these people alive with their damaged heart. And if you're not thinking about that number when you're trying to decide, like, how are we going to restructure our system as Tennesseans, then great. You know, we've kept the businesses afloat, and I'm not knocking, that's important, right? But if we're going to bankrupt ourselves on the other end, you know, the P&L statement at the bottom doesn't really add up. And it's not that healthcare cost should be the driver either. It just needs to be part of the equation, is all I'm trying to say. Now this is a great slide. I love this slide. And the reason I love this slide is that it's basically telling you that once you get this PM through and into your bloodstream, everything's affected. Everything gets revved up. Your immune system starts trying to understand and cope with it, right? And because every organ has a blood supply system, and we think that inflammation, it's the most misused word in medicine, but I'm going to use it anyway, in quotes, is an underlying driving force for heart disease, for cancer, for dementia. Pick your disease. It's linked. That if you've got this exposure that starts at day one, that now particles get so small that they don't even have a barrier, they go straight to your bloodstream, and your immune system is forced to deal with it from every day you're alive until you die, you start to understand the potential magnitude of this from a healthcare and a healthcare cost perspective. I mean, it's potentially enormous. So I think with that, I'll simply stop and say CVD is one small piece of this puzzle. It's something I know a little bit about. It's everywhere here and around the world. We know air pollution is here and around the world. We know that there are short and long-term exposures. Both seem to be linked to cardiovascular disease, and there's multiple mechanisms. All I would ask for the people in the room is that as you're putting this big budget thing together, and it's complicated, and I know I don't understand all of it, but I would tell you, you would be remiss if you do not at least think about what the downstream costs are going to be for this state, given the exposure to these products as we're trying to afford everything. And, you know, I'm not going to get into the politics of whether we should, you know, with the whole, what the government wants to do and giving health care to other people. All I know is people aren't going to stop coming to my hospital, whether they have insurance or not. They're coming because they're ill. You know, and as a physician, I have an obligation to treat them, whether they have insurance or not, because that's what I signed up for. But that doesn't mean because my obligation treats them when they don't have money that it ignores everybody else to stop thinking about it. You know, we're all neighbors, we all live in the state, that's what we preach. It's a big deal to me. We need to think about this. That's all I have. Thank you.